Hey everyone, this is Dr. Suriaga, along with my co-presenters, Dr. Ruth M. Tappen, Dr. David Newman, and Dr. Lenny Chang-Hanesco from Florida Atlantic University. We would like to share with you that our study titled Opioid-Related Accidents and Suicides in Older Adults. As you can see, since 1999, the United States has experienced an opioid epidemic. And almost 500,000 Americans died from opioid overdose deaths. And most research is focused on the younger population or adults, but less on older adults. The Agency for Healthcare Research and Quality reported that there was an opioid crisis among all older adults in this country. And this study is significant because it impacts the patient safety when it comes to opioid administration to manage the pain of our patients. And in this study, we can see that a lot of older adults died with opioid as a cause of death, died in accidents and suicides. And this is determined by the medical examiners through the urine and toxicology results. This study, we utilize a quantitative design. This is secondary data analysis, and we use the Florida Department of Law Enforcement, or FDLE, their data from 2014 to 2018. And it included all Florida counties and equals 67. So in this study, we have a sample of 1,107 older adults who died with opioid as a cause of death. And there were around 3,234 older adults who were determined to have opioid in their system at the time of death. The opioid as a cause of death is critical because, according to the medical examiners, the drug played a causal role in the death of a person, in this case, an older adult or person 65 years and older. So in this study, we utilized the theoretical framework of Dr. Yuri Bronfenbrenner. The theory was the socio-ecological model, and this was also adopted by the Center for Disease Control and Prevention. It has 4 levels: the individual, relationship, community, and societal level. The data we use for the individual: race, gender, and age of the person, in this case, the older adults. In the community data, at the relationship level, we have the opioid use, either from the provider's prescription or from other sources. We don't have the definite sources that it came from the provider, so it's only a data from the Florida Drug and Law Enforcement Agency. For the community, we use the characteristics of population density, education level, median household income, and percentage of people in poverty by county level in Florida. And opioid death rate in Florida and statewide data on education level, poverty level, and again, the median income included in the societal level for this model. All right, so the characteristics of decedents or older adults who died with opioid as a cause of death, as you can see, it affected more than half were male older adults, and majority were non-Caucasian non-Hispanic whites or Caucasian, 93%. And it happened mostly in urban or metropolitan counties. And the manner of death, as you can see here, majority died from accidents, 56.01%, followed by suicide, which is 39.92 or almost 40%. So, as you can see in this slide also, the drugs that are involved in accidents and suicide in older adults, you can see that codeine, fentanyl, fentanyl analog, heroin, hydrocodone, hydromorphone, morphine, oxycodone, oxymorphone, tramadol, they were associated with the manner of death, especially on accidents and suicide, which is statistically significant. With the large effect, effect size, we have fentanyl analog and heroin, followed by codeine and morphine. So the results of this study is that we use a chi-square test of independence, and it showed that there was a statistically significance relationship between the manner of death, MOD we call that, of older adults who died with opioid as a cause of death, Again, it was determined by the medical examiners here in Florida. And the type of opioid drugs involved, which is statistically significant, P equals or alpha level of less than 0.05. And more older adults with opioid as a cause of death died from accidents, as I said, 56%, followed by suicide, which is almost 40%. And it was surprising to see that there was no older adults reported to have died from opioid as a cause of death, along with comorbidities or natural cause. The opioid drugs again involved were codeine, fentanyl, fentanyl analog, heroin, hydrocodone, hydromorphone, methadone, morphine, oxycodone, oxymorphone, and tramadol. And for the implications of these studies, that it is very important for providers to take a look of the kind or the type of opioids that were prescribed to older adults, especially those who are implicated or opioids that were implicated in accidents and suicides in this vulnerable population group. So if you have any questions, please feel free to reach out to me. My email address is asuriaga2016@health.fau.edu. And to acknowledge that this research was funded by the Florida Nurses Foundation, Edna Hicks Research Fund, and Sigma Iota Psi Chapter at Large. Again, thank you very much for your attention to this important study.